Okay, it's 3 o'clock, so I'm going to go ahead and start, and if anyone else enters the room late, this will be recorded, and so you'll be able to go back to the beginning and watch some of the things that you may have missed. So for those of you who don't know me, my name is Dr. Alyssa Cooper. I am a naturopathic doctor over at Living Wellness Medical Center, and I wanted to do today's webinar on acne. Acne is something that's very near and dear to my own heart, something I've personally struggled with, and something that I help navigate for a lot of my patients. And so I wanted to go over Acne 101 and get into some of the nitty gritty, but really get into what are those potential causes or triggers. A little bit of a preview, there are many, and there could be many happening at the same time. And then we'll go over a little bit of an interview as well about what is acne. So to begin the agenda for today, we'll discuss what is acne, some common causes, some common triggers of acne, some various treatment strategies, and then at the end we will do a Q&A. And so if you have any questions throughout the presentation, I won't answer them in the moment, but at the end, if there are any questions, then I will answer them then. So go ahead and add some questions to the chat, and I will hopefully be able to get to all of them today. So what is acne? Most people think they know what acne is, but it's kind of cool when you get down to really what's going on underneath the skin, what's causing those lesions to appear. So acne is an extremely common inflammatory condition of the skin. It occurs when hair follicles under the skin get clogged by sebum or oil and or dead skin cells. Typically, it's both. Typically, there's the oil and the dead skin cells that are going to cause that raised inflammation to happen. And so if you look at the acne formation photo, this one I thought was really interesting because it really shows all of the underlying factors that could contribute to both the sebum production and then also that skin turnover. So you'll see that there's a pore, and then at the base of the pore, we have those two little pockets to have some sebum production. That's where our body naturally produces that sebum and that oil to help hydrate our skin. But what can happen with acne is that either there's too much sebum there being produced, or it's getting clogged in that pore. And so it gets clogged, that allows bacteria to proliferate, and then you'll see that rupture of the canal, and you'll see that inflammation on that layer of the skin that we can visually see. Some acne is underneath the skin, and we'll get into that next. So these follicles can also accumulate bacteria or fungus, and so it's important to think about that when we're thinking about treatment strategies, when we're thinking about what are some of the causes, what are some of the underlying factors that have to do with acne. So, types of acne. There are actually a lot of types. This was a good review for me because when you think about acne, you typically just think about the classic pimple, and a pimple or a pustule is a papule. That's just a little raised area topped by white or yellow pus-filled lesions that may be red at the base. So that's the most common type that we think of, I would say, as a population. When we think about acne, we think about those pimples. But whiteheads, blackheads, those are actually types of acne. So whiteheads are plugged hair follicles that stay beneath the skin, so they produce more of that white appearing bump. Blackheads are plugged follicles that reach the surface of the skin and open up, and the oxygen actually discolors it to make it look more black than the whitehead. Papules are inflamed lesions that are usually small, pink bumps on the skin. Those can be tender to the touch. We covered pimples. And then nodules are typically those solid lesions underneath the skin. I typically see these in patients more along that jawline, especially when we're thinking about cystic acne, which is also considered severe nodular acne. Those are deep, painful, pus-filled lesions. Again, when we're thinking about the hormonal cystic acne, that is very common. That tends to be under that jawline, around the chin, sometimes up in the cheek. And so when we think about acne, just remember there's a lot of different types that we have to consider. So assessing acne, this is what I'm thinking. When I have a patient come into me and they say, hey, I have this acne, either it's new or I've had it since I was a teenager, what are the things that I want to look at? First, I want to see what type of acne is it? Is it cystic acne? Is it just a few little pimples, some whiteheads, and then where is it located? Where it's located can help us determine what are some of the underlying causes, because again, that cystic acne typically has a hormonal component with it. The severity is important to note because I want to, visualize how severe is it. How severe it is also sometimes leads to some of those presence of complications where there's that post-inflammatory erythema in the area, post-inflammatory hyperpigmentation. And so this is after the acne lesions heal, we still have some of that erythema going on, or we still have some of that hyperpigmentation. Erythema just means redness for any of you who don't know. I know I'm using some medical terms that might not be common knowledge. And then also potential contributing factors. This is where naturopathic medicine, holistic medicine really shines because we're looking at it as a multifactorial lens. So it's not just an issue of the skin. The skin shows us what's going on internally. And then another thing to think about with acne is just your body trying to communicate with you that there is something going on. I know it can be so distressing emotionally. You might not want to leave the house. You might know, oh, my period's about to come and I'm going to have some acne, so I don't want to do some of these social events. That can be the case for a lot of people. Other people have learned to really just love their skin, and we'll talk about that later in the treatment, but having that self-compassion for yourself and knowing that this is part of your body communicating with you. Some people can do all the things, have a really poor gut barrier, gut health, and not get acne, and other people are more susceptible. So who gets acne? I wanted to throw this in here because it is not just teenagers. Most of you that are watching this probably already know that because you're likely adults that might be struggling with acne or know someone that's struggling with acne. And so there was a survey of over 1,000 adults, and these were the self-reported percents of acne in those individuals. So you'll see as we age, the percent goes down, but I still have patients in their 40s, in their 50s that have acne, and they think, why do I still have acne? I thought this was supposed to be done when I was a teenager. Why is it happening now? I also have some other patients that didn't have acne as a teenager that are now starting to get acne, and that baffles them even more. So we'll talk a little bit more about this when we get to what are those causes, what's some of the underlying factors. So here we go. So potential triggers of acne. Again, there are so many, and some of these don't exist in isolation. They directly are interrelated to each other. So gut health, first and foremost, our skin truly is a mirror of what's happening in the gut. And we'll dive into these a little bit more, but this is just an overview. So gut health, blood sugar imbalances, again, ties into gut health. Nutrient deficiencies ties into gut health. Hormonal health can also tie into gut health. Hormones and gut is really the chicken or the egg. Is it the hormones? Is it the gut? Which one happened first? Which one's causing the other? It really depends on what's going on. Stress can make all of this worse. Topical or environmental irritants, medications, and we'll cover topicals. And I have a really cool tool that I found when I was doing research for this webinar that I can share with you guys. So gut health. Gut health is huge. And gut health really is going to show us what's that deep underlying root for a lot of people. So I typically start with gut health when I do have a patient that has acne. I want to look at how are your bowel movements? How is food sitting in your stomach? Is it feeling good? Is it not feeling good? Do you feel weighed down by the food, or do you get sleepy after the food? That goes a little bit more into blood sugar, which we'll talk about next. But main things when we're thinking about gut health is really processed foods, sugar. Unfortunately, we all love a little bit of sugar, but sugar is so inflammatory for our skin, and sugar along with dairy can increase something that's called insulin-like growth factor, which stimulates sebum production at the site of our skin, so at the acne itself. And so some people can tolerate dairy, other people, it's one of the number one triggers. And you'll know if dairy is contributing or causing your acne, because typically with dairy, you will see a breakout in the next 1 to 3 days. Some of these other foods take longer, and it's really that dose-dependent reaction of, oh, I had a little bit of, sugar in this candy one day, I was fine, but then I went out and had a few drinks and also had some dessert then, and then the next day they break out. Inflammatory oils is another one. These can definitely clog our pores. And so these are more common when we're eating out. So some of that soybean oil, canola oil, etc. Those can also lead to a breakdown of that gut barrier, causing a little bit of that leaky gut, With leaky gut, so much happens because when our gut is leaky, we're eating food, we're eating nutritious food, hopefully, but some of those nutrients are not getting absorbed. Some other ones I did want to mention here that were interesting to me. One is gluten. Gluten, again, depends on the person, or it depends on where you're getting the gluten from. So for a lot of people, they can tolerate gluten if they're in Europe, for example, but the gluten here has been so processed, our wheat has been so processed that gluten can lead to inflammation, can actively contribute to that leaky gut situation for many, and then cause us to go into that nutrient depletion category. Eggs were another interesting one. This one was actually a little shocking for me. So in my research, I found that eggs are associated with more of that lymphatic acne. And so lymphatics tend to be around the nose, kind of on the upper lip area and the chin, but also under the neck where those lymph nodes are. So if you're having a lot of acne there, this could be something to consider, is cutting out eggs for 3 weeks, not forever necessarily, but as a good trial, cutting them out for a few weeks, reintroducing them, and seeing how your skin does. And in general, doing an elimination diet is really gold standard to see if you do have any food sensitivity. And so that means cutting out gluten, dairy, eggs, nuts for a month, reintroducing them one at a time after that month, and seeing how your body reacts. And so I wanted to bring up those because eggs was really interesting to me. And I tell a lot of my patients to eat eggs because of that protein content in the morning. And so one thing to consider if you are dealing with acne. Peanuts is another one. So peanuts have more of the omega-6 fatty acids in them that we don't particularly want. We get enough of those through our standard diet anyway. We want nuts that are more heavy in the omega-3s, like macadamia nut, and Brazil's nuts are great because they have the selenium content for our thyroid, which we'll talk about later. And then also with dairy, just make sure you consider all the hidden dairy. So whey protein increases insulin-like growth factor, which is then going to increase that sebum production. Next, I wanted to quickly overview all the steps of digestion. So digestion starts in the mouth. We have enzymes that are secreted when we're thinking about food, when we're preparing food, that gets our body ready and primed. So it's really good to eat mindfully, really chew your food, think about the textures of the food that you're eating and how it feels in your mouth to really secrete those enzymes. Then the food travels down the esophagus into the stomach. We have stomach acid there that is released to break down that food. We want a good amount of stomach acid, not too little and not too much, to break down that food so it can then travel to the small intestine, and that's where most of our nutrients get absorbed. They get absorbed in the small intestine, then go through the large intestine. That's where all the bacteria that we want there help to better break down the food, and then our food is passed through stool. So if you're having chronic constipation, that could also be related to acne because you're not clearing out all of the food and then all of those toxins that we accumulate day to day, just living in a world that has pollution and pesticides and all of the things. So that's just a quick overview. GI conditions to consider. So if someone has acne, I want to look at these things, not necessarily all of them, but use your symptoms to also guide what do we need to look for. Low stomach acid is one. So is that food not being broken down? Food sensitivities. So again, these could be the major culprits: gluten, dairy, eggs, nuts, or they could be something that is less common and you do a food sensitivity panel and say, oh, I'm actually reacting really heavily to rice. What is that about? Sometimes it could mean that you're just eating the rice with most meals. And so it's a little bit of that false elevation, but it's also good to know, are there foods that you're eating that your body is having a hard time either digesting or processing? And then those foods bypass the gut lining and our body looks at those as invaders and causes inflammation. H. pylori is one, parasites is one, fungal or yeast overgrowth, and then SIBO. SIBO can directly lead to food sensitivities and leaky gut because it's in that small intestine where we want those nutrients to get absorbed and where we want that function to be really optimal. And then these are just different factors that impact our gut microbiome. So we really want to make sure our gut microbiome is looking good. We want the bacteria where we want them. We don't want any of the bad bacteria coming up into the small intestine. And so this is where some people taking a probiotic clears up their skin very quickly in some cases. Again, not always. Usually it's not just one thing that we have to change, but it's something to think about. So these are all the things that impact our gut microbiome, where we live, so what we're being exposed to in our food, pharmaceuticals, our diet. We really want to increase the variety of the foods in our diet, and so it's important to eat different fruits and vegetables throughout the week and not just stick to the same meal every single day, because then we're really impacting that gut microbiome. Stress, how you were fed as an infant. So were you breastfed? Were you bottle fed? The birthing process, did you go through the vaginal canal and get covered in a lot of those microbiome supporting bacteria from your mother? Or were you birthed from a cesarean section? And then just different life cycle stages will also impact our gut microbiome. Next is blood sugar imbalances. So with blood sugar imbalances, we know that if insulin resistance is happening, insulin directly communicates with the sebum and androgen production. Androgens are testosterone, dihydrotestosterone, DHEA. Those are things that then can make that oil production happen more readily and lead to more acne. And so here you'll see a really nice graph. This one connects everything, so I wanted to put it here because it also touches on the gut microbiome and how the gut microbiome, insulin, and our sex hormones really all together work to cause or trigger acne in individuals. Insulin, if you're one of my patients, you've probably heard me say this many times, insulin is like the key to the cells. So when we consume sugar, carbs, fruit, our body goes, oh, there's a little bit of sugar here. Let's move it from the bloodstream where we don't want it into the cells where we do want it. And if that happens, and if that blood sugar is going higher and higher, we have to pump out more insulin to compensate for that. That's when we can start to get into that insulin resistance where we're not sensitive to that insulin anymore. So our pancreas is really pumping out more to get that sugar into the cells, and then it's not responding. So blood sugar is huge. Main things for blood sugar, which we'll talk about in treatments, is making sure you're getting enough protein. Again, that's something I tell most of my patients, if not all, is let's prioritize protein intake. Let's make sure we're eating breakfast, make sure we're having good protein with breakfast, and keeping that blood sugar balanced throughout the day. Next are nutrient deficiencies. And so vitamin A, this is something that we don't get a lot of in our diet. Vitamin A in its form that's going to be helpful for the skin, not necessarily beta carotene, can be found in foods like liver, some beef, eggs again. So just depending on if you have a sensitivity to eggs or not. Vitamin E is also very supportive for the skin. Our omega-3 fatty acids, so fish oil, fresh fish, salmon, etc. Probiotics, zinc. The list can go on, and we'll talk about some different nutrients that we want to make sure are on board in the treatment section, but these are some key ones where if there is a deficiency here, we know that acne can be more likely. Hormones. So hormones could be a multitude of different ones. We mostly think of excess testosterone as the main one because we know testosterone is going to increase that sebum production. But estrogen is important as well, and so is progesterone. Estrogen, if it's too little, our skin is going to be more dry. It's not going to have that elasticity. And especially living in Arizona, we have lots of dry skin. Dry skin alone is a risk factor for increased acne. And then if we're having too much estrogen in comparison to progesterone, then we can also have more oil production. That was a tongue tie. And then testosterone. Again, testosterone is pretty big. We think about this in patients that have PCOS, where we know there's that excess testosterone, and those patients typically do tend to have more acne than patients without PCOS. Thyroid dysfunction here. So low thyroid function can contribute to dry skin. So hypothyroidism can cause dry skin, making you more susceptible to acne. Too much hyperthyroidism can contribute to more oily skin and then also promote acne. This is the hormone pathway. So this is the sex hormone pathway showing cholesterol turning into progesterone, cortisol, testosterone, estrogen, DHEA. So all of these are related. They can change back and forth into each other. And so it's good to look at hormones as, okay, there's all of these. It's not just testosterone or not just estrogen. Stress is huge. So when we're in states of high stress, then we know that we're pumping out more cortisol. More cortisol is very inflammatory to the body. More cortisol is going to have us hold on to more sugar because it thinks that we're fighting a tiger. And so that could also contribute to increased acne. When we're pumping out more cortisol, we're holding on to more sugar. And then also our sex hormones are not working as well as they could, and our thyroid's not working as well as it could. And then topical and environmental irritants. So pore clogging ingredients in your face wash, skincare products, SPF, moisturizer, and then shampoo. Shampoo is another one that my esthetician really talked to me about. She was talking to me about shampoo and body wash and conditioner, and I didn't think of that, but think of when our hair is touching our face, when we're sleeping at night, potentially rolling around or sleeping soundly, depending on who you are. I tend to roll around, and so I know my hair is getting all over my face. After I've washed it, I'm ready for my skin to heal, but your shampoo quality also matters. Some things that are pore clogging: shea butter, coconut oil, soybean oil. So a lot of those thick oils can be really pore clogging. And then parabens, phthalates, dyes, fragrances, those can also be very irritating to the skin. Various laundry detergents, masks. We know there was a lot of maskne that was happening when we were wearing masks all the time. Less so now, but still something to think about. Pollution, so just pollution from living in a polluted city and having some of those chemicals on our face can also contribute. Medications, so there's lots of medications to think of. What was very interesting here, and was interesting in the research that I was also doing, was that we have a lot of supplements that could actually promote acne that I was not aware of, such as B12, B6, B2. So those are a lot of things that are in acne specific supplements, but the dose matters. So if you're getting too much B12, that's something to consider. If you're getting too much zinc, that's also something to consider. So it's important that you show your doctor everything that you're taking. And if you have 5 supplements that all have B12 in it, that actually might be something that is leading to more testosterone production and then causing more acne breakouts. So some laboratory testing. This is pretty basic. We typically do more testing than this, but these are some really important things that I wanted to highlight, especially if you're asking your provider, hey, what about this test? What about this test? So definitely assessing blood sugar is huge. So that's a metabolic panel, looking at your hemoglobin A1C, really making sure they look at insulin and not just look at that metabolic panel. And then hormone testing. So looking at cortisol levels, estrogen levels, progesterone, DHEA, the testosterone, DHT. So DHT again is the more active, potent form of testosterone that can contribute to breakouts. And then thyroid panel, of course, and then advanced testing of gut health. So whether that's a stool analysis, whether that's a food sensitivity test, if all these other factors are being met, your gut health, well, I guess your gut health is the main one. If you feel like your hormones are balanced, you're working on your nutrients, you're working on your skincare, and you're still seeing acne, that could be a sign. Maybe there's a parasite, maybe there's a yeast overgrowth happening, and on, getting that tested and getting that looked up. Expectations for healing. I did want to put this in here. It really depends on your skin, but really on average, it takes about 2 to 3 months to notice major improvement. So it's nice to also track with photos, because some people, they think that it's not healing, but then they look back at photos of themselves from a month ago and they're floored. They're like, wow, I actually have much less, breakouts happening, but they still have some. So they think that it's still, there in higher amounts than it might actually be. So looking at photos is really helpful, but not getting too critical or taking photos every day. I would say if you are going to track progress, maybe, every 2 weeks, not doing it more than that, because you also don't want to be promoting that, critical nature of taking photos and feeling poorly about them. Conventional treatment. So I listed all the conventional treatment here. Spironolactone is huge. Accutane is pretty big. Benzoyl peroxide. These are not addressing the root causes. These are more Band-Aids. And so benzoyl peroxide is going to potentially dry your skin out. It's working to be an antibacterial agent, so kind of kill any bacteria that's on the skin, but it also can dry out the skin. And same with spironolactone, that's reducing androgens, but that's not getting to the root cause of why are you producing more androgens. And so here are a lot of the conventional treatments that if you go to a dermatologist, they'll likely recommend, because they're just addressing it from a topical perspective, really, or from just the skin perspective and not looking deeper. Naturopathic treatment, so looking at foundations of health. So nutrition, again, really optimizing nutrition. Hydration is huge. Again, living in Arizona, it's very dry. We need to make sure that we're hydrated from the inside out, so getting that hydration in. Movement can help with that lymphatic drainage, that detoxification in the body. So we want to make sure that we're moving, that we're sweating. Sleep is where we do so much healing, so making sure you're getting good sleep. Stress management, self-compassion again. So really looking in the mirror and telling your skin how much you love it and how confident you are in it, that you're going to get to the root cause and that you're going to heal it, can be huge. You really have to believe that you're going to heal sometimes. Minimizing processed foods is huge. So I put some oat milk on here because I know we all love a little bit of oat milk, but even looking at oat milk ingredients, and a lot of times they do have higher sugar content than we would like. And so looking and seeing, okay, there's these oils, there's these gums, there's these additives. Let's maybe switch to one, or switch to a coconut milk or an almond milk that has less ingredients and has less sugar, because a lot of people, again, are having their coffee in the morning with their oat milk before they eat. Please eat before you have coffee. If you don't take away anything else from this, please eat before you have coffee. That will be so good for your adrenal health. And so looking at the ingredients is important. Supplemental support. So this is so varied by individual. So if we want to replete nutrients, these are some of the very important nutrients for skin health. Reduction of androgens. We have saw palmetto that prevents the conversion from testosterone to DHT. Singing nettle, spearmint, green tea. Spearmint, some people say, is a natural spironolactone. So drinking a few cups of spearmint tea a day can help bring down those androgens. And then liver support. Our liver processes everything. And so we want to make sure that that liver is able to clear and process the things that we come into contact with. Topicals, so high quality skincare routine is so paramount. We want to do internal work, but we also want to make sure the stuff that we're applying externally is good and is not pore clogging. And so one thing that you can do is check your products. So there's a link here. This is through the company Clear Stem. I'm not necessarily recommending their products, but I love that they have this pore clogging ingredient list where you can literally copy and paste the ingredients from your skincare, from your shampoo, from your body wash, from anything, and see if it contains a pore clogging ingredient. If so, it's likely time to switch to another product. So if you want specific product recommendations, reach out to me. I can give you some, or ask your provider, ask an esthetician. They should know, and they should know what pore clogging ingredients are. So there's a link for that. Microneedling, this more so helps with acne scars that are a little bit deeper in the skin. So this is something that we offer at Living Wellness Medical Center. And there's just little needles that go in that stimulate your body to realize, oh, we have a little bit of inflammation, which means we need to bring some healing components to the skin, turn over that skin, turn over that collagen, and help reduce the production of those scars. And then consult an esthetician. I just went to an esthetician for the first time a month ago. It was amazing. They have so many cool gadgets and gears and devices and topicals that they use to really help with skin, with that skin turnover, with reducing the inflammation. And so that's something also to keep in mind, is that having a good esthetician on board to guide you in some of the purchases of different skincare regimens, moisturizers, etc., is right for you and right for your skin type, because there are various skin types as well. All right. I tried to get through everything. I saw that I was running out of a little bit of time, so I apologize if I spoke very fast. I tend to speak very quickly during these webinars, and so let me check the chat and see if there are any questions. Okay, I do have a question about Accutane, and if Accutane is something that I would recommend. Accutane is pretty tricky. So how it's working is by really promoting that cellular turnover in the skin to a pretty intense degree. And so it promotes cell turnover, so that's kind of purging the skin, trying to get rid of the acne and get new cells to come and to grow. It is a synthetic form of vitamin A, so that's how it's working. The one thing with Accutane is that I have seen in a lot of people that, one, it could be very toxic to the body. So you have to check your liver enzymes. If you're a female, you have to be doing a pregnancy test before you get your refills. You have to check your cholesterol levels. There's a lot of things that you have to keep an eye on because it can be very toxic to the body. Same with drying out the skin. It is known to dry out the skin. A lot of people have very chapped lips when they're on Accutane. And for some people, it works. They do it once. They don't have acne again. For other people, it doesn't, because again, you're not really getting to the root cause with that. And so I would recommend more of a holistic approach, looking at, okay, how is my gut? How are my hormones? Because if you don't address those things, then the acne may just return. So that would be my recommendation around that. A lot of my patients ask me about spironolactone. Occasionally, I do recommend it if we've tried a lot of other things and we really just kind of want to get to the end and to speed up that process. But it is a diuretic, so it's going to make you urinate pretty frequently throughout the day. It can reduce blood pressure, and so I have patients that already have low blood pressure. We don't want to put them on something that's going to lower it even more. But I tend to have more patients that come to me already on it versus me prescribing it. And so if you have any questions about any medications or topicals, please feel free to reach out to me. I love this stuff. I love skin health, dermatology, and acne specifically, probably because it's important for me as well. And it's something that I have. So, all right. I hope you all have a lovely Friday. And I'm going to go ahead and end the call now. And for any of you that just joined or joined in the last half of today, this will be recorded. This will go out on our YouTube channel. So just stay tuned for that. All right. Have a lovely day. Bye, everyone.